The last several months I've spent in the field has allowed me to see firsthand which policies and practices work well and where we can improve the quality of patient care. Listening to your widely expressed concerns, I've reviewed the LA County Fire Department's own, more conservative versions of several DHS policies. After careful deliberation, it's been determined that these policies require significant expenditure of ALS resources and aren't based on any medical evidence or demonstrable patient benefits. I discussed my findings with the fire chief, and after careful consideration, the fire chief, with the support of labor, approved eliminating the LA County Fire Department's versions of 808.1 and 506, and we will be adopting the DHS versions of these policies. This would require us to make extensive changes to our current patient care guidelines, so we've decided to eliminate the patient care guidelines as well. As we make strides to update our technology at the point of care with the new Zoll X-Series monitors and our upcoming Physio-Control ePCR, it seems counterintuitive to update a guidebook that sits on a shelf in the station. Instead, we're advocating for newer technologies like the LA County Paramedic app, which puts all the DHS policies at your fingertips at the bedside. The purpose of our pre-hospital 12-lead EKG is to rule out STEMI, not to check a box. Therefore, we're moving away from the LA County Fire Department's 12-lead policy and adopting the DHS indications. Going back to the DHS policy will require you to use more judgment, but should also reduce the overutilization of this ALS-only skill. We'll also be changing our guidelines for blood glucose testing. The diabetic patients who benefit from a field intervention are those with hypoglycemia. While hyperglycemia is important to the overall health of our patients, no intervention in the pre-hospital setting has ever been demonstrated to improve outcomes for patients with asymptomatic hyperglycemia. Our new guideline will reflect our attempt to diagnose and treat patients with significant hypoglycemia. These changes should allow our paramedics to utilize their skill and judgment to the benefit of our patients while simultaneously reducing the overutilization of our heavily taxed ALS resources. Your division nurse educators will be meeting with you to discuss these changes in more detail, and I look forward to meeting with more of you as I continue to ride along throughout the county.